As a nurse, you walk into your patient's room who's just been told he has kidney failure. He has a multitude of questions. Are you able to help answer those? Hi, my name is Debbie, and I've been a nephrology nurse for over 25 years. Tonight, for my informative speech, I'd like to talk to you a little bit about a patient with kidney failure and the options that they have. According to Susan LaRocco, who is a registered nurse in the nephrology field, patients in kidney failure have two options: dialysis and transplant. Tonight I'd like to talk to you a little bit about each of these options and what they mean. For dialysis, a patient has an option of choosing hemodialysis. According to the National Kidney Center, hemodialysis is the cleaning of the blood, removing toxins and waste using a filter. How this process works is a surgeon will place an access in a patient's arm that we are able to cannulate with each treatment. How we cannulate them is using a 15-gauge fistula needle. We place two of these in the access. One is to pull the blood from the patient. The second one is to put the clean blood back to the patient. How the removal of the toxins and waste work is that we use an artificial filter, or what we call an artificial kidney, which is what this looks like. Through osmosis and diffusion, we are able to pull the toxins out, which goes down into a drain. The blood comes back through the filter and goes back to the patient clean. With this type of dialysis, patients run 3 days a week, usually either Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday, and they're usually there between 3 and 4 hours with each treatment. The second option that patients have is what we call peritoneal dialysis. According to the National Institute of Health, peritoneal dialysis means cleaning of the blood using the abdomen and the peritoneal membrane. How this process actually works is a surgeon will place a soft catheter inside the abdominal cavity with an extension on the outside that the patient connects up to. This is a bag of solution that the patient will use. It's about 2 liters of fluid. It's sugar water with other electrolytes in it. How it works is the patient places the fluid into the abdominal cavity. It sits for 4 to 6 hours, and then they drain that fluid back out and then put new fluid back in. This process of peritoneal dialysis is 7 days a week, and they usually do between 4 and 5 treatments with each day with it. So that's the process of doing peritoneal dialysis. The third option that we can choose is what we call kidney transplant. And according to the American Journal of Nephrology Nursing, transplant is the closest and treatment of choice for most patients. And the reason they choose that is because it is the closest to what their native kidneys will do with it. How the process of transplant works is that the patient goes onto a waiting list and they wait for a donor. The donor could either be a cadaver donor or a living related donor. A living related donor is someone that's related to you, a father, a sister, an aunt, an uncle. They're even starting to do spouses to see if they match. The reason why they're trying to look at that is because, according to Dr. Gabriel Donovich, back in 2010, there were over 93,000 patients on a transplant waiting list waiting for kidneys. With this, they go into surgery to have the kidney placed. They're in the hospital for 4 to 5 days. They go home afterwards. So tonight I kind of talked a little bit about the options they have: hemodialysis, peritoneal dialysis, and transplant. I hope you've learned a little bit, and thank you for listening.